Universal healthcare is healthcare that's accessible to everyone, and it's affordable healthcare, preferably free, but if it's not free, at least somewhat affordable so that people can be able to have access to it without fear of discrimination, without fear of stigma, and can actually afford it. At least that's what it means to me.
Universal healthcare is and should be accessible to all persons, particularly for persons who are most vulnerable and marginalized, and for those who can't afford private health care. So some trans-specific healthcare services that are needed in Jamaica includes access to hormone replacement therapy, particularly for persons who wish to medically transition. While medical transition is not critical or important for all trans persons, there are some persons in Jamaica who wish to access hormone replacement therapy. And unfortunately, this is not accessible through public health care, and this is detrimental to the well-being of the trans community.
Well, definitely HRTs, access to HRTs is a must. Currently, there really isn't any programs around that provides HRTs to trans people. People usually have to go to outside sources to get it, and it's kind of pricey. And we don't really have like endocrinologists in Jamaica that can offer those services. So that's something that's needed. We need more skilled professionals who are able to administer HRTs. We need to be able to access HRTs. There also needs to be more trans-specific professionals who can actually do the surgeries. So those are some of the things that we are in desperate need of. Stigma and discrimination continues to be like a major barrier to trans-specific healthcare. And I think particularly too, it's because clinicians just aren't aware of the trans community. And for me, that's not an excuse, because I mean, there's internet, there are so many people around who are visible. But the truth is that people really, or clinicians really don't know that much about the community. And because they don't know, they tend not to be able to provide the services that trans people need. Is that okay? It's not. Is there more that clinicians can do to provide more holistic services to trans people? Yes. And where does it start? It starts with them actually getting information, doing their own research, as well as reaching out to people who are from the community who can help to provide that information.